Today I will talk about a spine technique which is called OLIF and ALIF. OLIF stands for oblique lumbar interbody fusion. ALIF stands for anterior lumbar interbody fusion. This technique has been published and accepted and published worldwide as being the best corrective technique, as being an improved version of the corrective technique for spine and giving better results compared to the other spine surgical options being done all over the world. The difference between the ALIF, OLIF and the other spinal surgeries is mainly the size of the cage which can be placed in the diseased disc. So this is the size of the cage which we do with the routine spine surgeries, in which we do all the surgeries from the back. This is usually the size of the cage that can be placed in the diseased disc which has been taken out and the empty space created. However, in OLIF and ALIF, we can put very large cages compared to the normal cages we do in the all posterior surgeries. The difference between these cages is first the size of the cage, second is the height of the cage, third is the space in the cage which gives increased, which allows me to put at least more than 10 times the volume of bone graft into the disc space, which is important for the spinal fusion and improved results. Another advantage is because of the size of the cage, I can bring more angles in the cages to help restore the normal lumbar lordosis. Lumbar lordosis is nothing but the angle at which a lumbar spine stands to allow you to stand straight. A human being is naturally made to stand straight. Because the pelvis is tilted at an angle, the lower lumbar spine is curved backwards to allow you stand straight and look ahead so that you can walk properly. So whenever we do a spine surgery, we are doing a spinal fusion. We have to make sure that the level which we fuse is fused at an angle that is natural for that level, so that the next level which is not fused does not have to work harder to keep you or make you stand straight. If I can achieve this by doing in good alignment at this level, I reduce the risk of adjacent level, that means the next level problems, and the risk of future spine surgeries using the ALIF and OLIF technique. When I put this big cage, I can raise the height of the spinal column, which allows me to increase the gap for the nerves to come out, indirectly taking the pressure of the nerves and keeping them free for long term in the future. Now the thing in ALIF and OLIF is that it requires a cut in the abdomen and a cut in the back, because a small cage can be placed from the back, because in a normal routine spine surgery what we do is we make a cut in the back, we put the screws, we cut the bones, we move the nerves, and then we put the cage. But this big cage cannot be placed from the back. So I make a cut in the abdomen, I find the natural planes between the muscles, and I reach the spine, and then I put this big cage which can take the complete load of the spine. This big cage filled with the bone graft gives a very good support, because 80% of the weight of the spine is passed from the front. Therefore, it becomes important that the cage is strong, big, and has a lot of bone graft to allow for early fusion and early recovery and less risk of failure. If I compare this to the normal TLIF cages, the cages are small and they carry a risk of failure within the level, plus the low amount of bone graft does not help in the spine surgeries. It has been published that anterior spinal corrections, ALIF and OLIF, give a very good spinal result, and they correct the spinal deformity. I have corrected adult scoliosis, in which a lady 60+-year-old had a curve of more than 50 degrees, but using this technique I was able to correct it to less than 10 degrees, and she is doing well. So long-term results of OLIF and ALIF have been published, and I also have personally found it to be successful in my practice. Patients usually do not come back for back pain and other issues, and they recover faster. I offer my patients this surgery if I feel they would benefit from it.